Hello, good evening, and how are you? Welcome to another session of Ask the Doctors. This is a health program that holds every Sunday by 8 p.m. West African time. My name is Frederick Unubohai. You can call me Dr. Fredo Star, and like I always tell you, good life, not sense. Now, if you're watching this video after we have ended, I'm sorry we might not be responding to you. It means you were unable to join us live. You understand? Yeah, the time is 8 p.m. and today's date is 19th February 2023. Now, I have some people watching me live right now. I'm live on Facebook and I'm live on YouTube. So if you can hear me, just tell me where are you watching me from? Your name and where are you watching me from? Let's go. I can see we have about 17 people already online. How are you? Yeah. Hello, good evening. Do not forget to share the live. Please share this live. Click on the like button. And also remember, you can send stars. Today's program, we're going to be taking your questions. If you have any questions for me, please feel free to drop your questions. My colleague will be joining us very soon. And when he comes, I'll bring him up and then we can take all your questions. So we have who's here? Dennis Fumilayo, how are you? Fumi, how you day? Where are you joining me from? Judith Oma. Judith, how are you? Ibrahim Ochidi, how you day? Oyamina, tell me, where are you watching me from? Taiwo, Titi, hi. Agatha, you mean any Christians? Any Christian. Agatha from Kaduna. Okay, no problem. How is Kaduna? Ask me any medical questions, please. Today is not it's not any medical questions. Yeah. Well, the rest people looking at me, where are you watching me from? Or yeah, talk to me. No, they sit down look. Hmm? All these you come online, you go they sit down, they look. Why? Why they sit down look? Eh? You they sit down look. Why? Ibrahim is joining us from Niger States. Somebody says, I did free mode though. Hey, yeah, sorry. Can I ask now? Go ahead, ask your questions, please. Watching from where? Evelyn, watching from Lagos. Hello, why is this now? Okay, oh, yeah, ask me. Marian is joining us from America. Oh, very good, nice. How is America? Ifoma, how are you? Oh, yeah, make una share. I'm live on Facebook and I'm live on YouTube. Hmm? Yep. Keep up the good work. Afiz Fatima Olabisi from Ibarapa Central Local Government or your state. Fatima, thank you very much. Becky Imafidon, thank you. Good job. Thank you. Amarachi Joyce, good evening. Watching from Abia State. How is Abia, Amara? We have somebody on YouTube. Yes, we have Vivian. Vivian on YouTube is watching us from Cameroon. And then Becky is watching us from Benin. So ask me your questions, please. Let's see if we can take your questions tonight. Now, remember, we don't prescribe medications here. We don't make diagnosis here. This place is not a clinic. So please, let's understand. Our job here is just to educate you, advise you. We always encourage you to go speak with your doctor. Hmm? Yeah. Ifama says she's fine. Edward is joining us from South Africa. Joseph, how are you? Joseph Mata. Oh yeah, make una ask me now. Why not they ask me question? Ask me. Grace Dunn. Okay, ask me anything. Ask me. I'm fine. Marian is okay. Good. Make una share. Share the live. Share the live. Share. Oh yeah, let's go. Hey, Evie is in the house. Evie, good evening. How are you? I'm doing good. Happy Sunday. Grace Dawn is joining us from Turkey. Grace, how are you? How is Turkey? Hmm? Accept our sincere condolences, the loss of life. in Syria and Turkey. Hope you are safe. I just shared now. Thank you for sharing. Ifoma, thank you for sharing. Oh, okay. Let's see. Oh yeah, make una ask now. Let's see. Let's see. Ask your questions. Or let's gist, Abby. Okay. If you want us to gist, no problem. Somebody's asking us a question here. Edward says, I started noticing something like dimples on my laps. Is there anything to worry about? Well, I wouldn't say there's anything to worry about. Just watch it. Dimples on your laps, watch it. No pain, no swelling. Give it time and see how it goes. And if you notice that there is a change from normal, then try to see a doctor. But basically, I wouldn't say you should start getting worried like that, but watch it. What is the cause of PCOS? There's a video on my page, Blessing Emmanuel. There's a video on my page on PCOS, that is polycystic ovarian syndrome. I would advise you to go to YouTube or Dr. Fredosta Official, my Facebook page, Dr. Fredosta Official. Watch it there. Grace, yes. You guys refuse to join my membership on YouTube. Okay. Doc, can someone have appendix mass and don't know and without pain? Yes. What are the symptoms of hernia? Do you know what hernia is, my guy? You should know what hernia means before you start asking the symptoms of hernia. Do you know what hernia is? What causes indigestion? Indigestion could be caused by anything. Sometimes when there's an imbalance in your GI mucosa, in your stomach, or you have issues with your microbial flora, yes, or um, or you have reflux, or you consume something that your stomach does not really like. Maybe you react to proteins or milk. Sometimes you can have indigestions. Do you understand? Yeah. Somebody's asking a question. Doc, my question is, you don't see your period for like 8 months. Later it comes looking very, very dark and you're almost 50 years. Please, what does it mean? Not seeing your period for 8 months, looking very dark. I feel that you should see a doctor. Number one, they would examine you and find out if it's something to get worried about. Maybe it's premenopausal symptoms. You understand? Maybe I'm using the word maybe, or hormonal changes, hormonal imbalance, or you are having issues with your uterus. You understand? Yeah. But it is not normal. Abubakar, ladies and gentlemen, if you are just coming, share the live stream, please. Number two, click on the like button, invite your friends. I beg you. I'm doing well. Let's see. Doctor, how to treat acid reflux without medicine? I don't know how you treat acid reflux without medicine, my dear. All these questions you guys ask me without medicine. I'm not a naturopathic practitioner. If your acid reflux need medication, you're going to take medication. But basically, what can you do to avoid acid reflux? Don't eat late at night. Avoid any food that will give you reflux or heartburn. Basically, you understand? These are the common stuff you can do. Stop late night food. Avoid food that can trigger your reflux, like food that contains pepper, food that what again? That triggers heartburn for you. You should know them. Yeah. Oh yeah, make una share the live. People are not sharing. If you share the live, tell me I have shared. I always have this pain by my left hand side under my breast, but it normally happens whenever the weather is cold. Is there anything to worry about? Off my head, I wouldn't say you should worry right now, since it occurs whenever the weather is cold. I wouldn't say you should get worried. It has been with you for a long time, Abby, right? Good. Then um I'm coming. Let me see something. Okay, good. I've seen what I'm looking for. So this pain has been with you for a long time. You know that it comes whenever the weather is cold. Avoid cold weather, full stop. But if you notice that the pain now becomes unbearable, or you're having other symptoms around your breast, see a medical doctor. Juliet Kitchen. Juliet, how you day? Agatha, thank you very much. Thank you, Ma. Esther, I did fine. Oh, how are you? Can a pregnant woman eat turmeric? I don't know. I don't know. I don't know about pregnancy and turmeric. I think turmeric is okay, but I don't know about the relationship between with turmeric in pregnancy. I don't know. You understand? Let me not say rubbish. Eh? I don't. I don't. Please speak with your doctor. I beg, yeah, Amara. Speak with your doctor. Lucy, good evening. He's Evie. You have shared to 15 people. God bless you. God bless you. The rest of us, you are not sharing, right? Doctor, what is the major cause of snoring and how to handle it? Snoring. Snoring is more common in people who are obese. Snoring is common when your airway collapses, when you sleep, the airway collapses, or you have enlarged tonsils. You understand? Yeah. So if you are snoring, I'm using the word common, and you are obese, overweight, you try to reduce your weight. You understand? Basically, and then try not to sleep very flat on the bed and see if you can sleep slant in 45-degree position if it will help you. These are just basic advice. This is not treatment. But if you have done all this and yet the snoring is still there, you will need to speak with your doctor. Let them find out more. I have shared. Vivian, thank you for sharing. God will bless you. In normal Christine. Hey, Christine, how are you? Yeah, yeah, long time. Good evening, Don. Good luck. Well done, well done. Edward says, what can I take to increase iron deficiency anemia naturally? No, you should not be doing this. Hmm? There's nothing like increased iron deficiency. Or you want to manage iron deficiency anemia naturally. How? Why are you doing this now? You should know that. See, guys, I'm not. I believe in natural stuff. I believe in lifestyle modification. I also believe in medication. I believe in prayer. When there's a need for medication, I will tell you. I'm not going to tell you to take anything naturally for iron deficiency. If you're having iron deficiency, you should take the medications prescribed for you by your doctor. Not that you have iron deficiency anemia and you're asking me what to do naturally. I beg you, my hand no day. Yeah, you take the medications prescribed for you. Do you understand? Edwards, yeah. Taiwo, thank you. Medications for high blood pressure, is it for and does it have is it for what? And does it have I don't understand. Engineer Paul, ask your question again. Engineer Paul Ire Osilama. Ask your question again. Inama, yeah. Isi, good evening. How are you? You don't tell. Thank you for sharing. Oh yeah, make una share. Keep sharing, guys. Doctor, good evening. Ishoma, I have been trying to get pregnant for the past 7 years, all to no avail. Please, what's your advice? And doctor said I and my husband are okay. Wow, madam, so sorry. You know, it's very, very, very traumatizing emotionally, physically, when a couple are trying to get pregnant and it's not forthcoming. It disturb, I know. But please, if your doctor is a gynecologist, I believe your doctor is in the best position to tell you the various options. Maybe they will tell you to try IVF or IUI. I know it's not cheap. I don't know. Yeah, there's a place of prayer. What God cannot do does not exist. Yes, we know that area day. But before God would do something for us, make we try do something too. You get still pray, because I know say people like prayer well. But please speak with your gynecologist or speak with a fertility expert. What can we do? Can we try IVF or can we try IUI or do we need to wait? How long do we want to wait? Do you want to wait for 10 years? Want to wait for 15 years? Want to wait for 20 years? I know there are couples, they've been trying to get pregnant and they'll tell you after 20 years they finally got the babies. I don't know if you can wait to that extent, but also Israel is here. But that will be my advice. Yeah. Also Israel, Alpha, do restless. Israel, how you doing now?
Fine, good evening.
Evening, how your side? Welcome. Happy Sunday.
Network has just not been. Interesting.
B. Okay, so I've been taking questions, ladies and gentlemen. We have Dr. Israel in the house. Dr. Israel, why you know on your why you know put on your headline? Why you off your headline? Why is your username not showing? What do you do? Okay. Do restless in
You
do
said?
restless what happen? Why you not put on your this thing? May I see your name now, eh? Let's see if it will show. Okay, it's here. Okay, fine, fine, fine. It's okay. It's there, it's there. Okay. Do restless leg syndrome ever go away? I don't know. The ones I have seen, I don't think it's ever went away. Though I heard that sometimes they place them on medication, but I've never heard where it disappeared. Maybe you are great, fine, but I don't think so. Dr. Israel, do you have any comment on this?
No.
Okay. Yes, you see, I'm good. Okay. Okay, somebody's asking us a question. I will allow Dr. Israel respond to this. Medication for high blood pressure, is it for life and does it have side effects?
Medication for high blood pressure and actually it's for life. It's for life, and there's no medication without a side effect. So there's one side effect or the other. However, your doctor will always want to give you the one with reduced side effect. However, if there's any side effect, if you express anything, you let your doctor know. He will know if it's the side effect of the drug and can actually change you from that drug. Even though we say receiving taking high blood pressure drug is for life, sometimes we also see some cases where we can alternate the drug or stop the drug for some time. But when the doctor says stop the drug for some time, during that period, you are supposed to continue monitoring your blood pressure. You are supposed to continue monitoring your blood pressure so that when if anything is going to happen, they can still take you back to medication. So you don't stop your blood pressure medication yourself because you think, I'm fine and nothing is wrong with me. I'm not having a headache, because most people attribute headache to high blood pressure. Hmm? You don't need to stop your medication. It is only your doctor, the person that prescribed the medication for you, that have the right to stop you that medication, and have also the right to taper the dose of the medication. Can actually reduce the dose. Can actually tell you not to take it every day. Take it alternate day. We can actually reduce the tablets you are taking. If you are taking maybe 2 tablets before, we can reduce it to one. Then maybe the one that you are taking, if you are taking 10 milligram, we can reduce it to 5 milligram. We can also say don't take it every day, take it every alternate day. And sometimes we may say, okay, don't take it for the week, but within that week, please come and continue checking your BP. And the reason, because we know that if you don't continue checking your BP and anything happen, and we may be held responsible that you know that this person is hypertensive and you refuse to give them their medication. So note, blood pressure drugs are for life, and yes, they have side effects. There's no drug without side effect. All drugs have side effects.
Thank you, Dr. Israel. And there is nothing like this medication can cure. So your blood pressure is now cured, has disappeared. I know there are people that will tell you that they have medication that will cure your blood pressure to disappear. For now, it's not proven. Huh? Okay, we have a comment here from Motunrayo Oluwa Folakemi, right? Omolola Babalola. She says, good evening. I like to drink Coke, but water is more than Coke. Is it bad? Madam, yes, it's bad. If you want me to be blunt, it's bad. I wouldn't even advise you to take soft drinks. I don't want to mention the brand again. Mark on their name. Before they go talk, say, yeah, they do bad publicity for them. I wouldn't want to take soft drinks. But if you must take soft drinks, you now have to start reducing it drastically. It's not good. You can't be taking it every time. It's not. Believe you me. I know there are people who believe that they must take sugar. You know, you don't need this. It's not healthy for you. Also, Israel, do you have any comments on this question?
Yeah, soft drinks, they are refined sugar, and too much of refined sugar can actually they are not actually very good for the body. Yes, even though you must take Coke or you must take soft drink, it should not be what you do every time or every day. There are some conditions we can say, okay, quickly take soft drink to help boost your sugar level as at that time. And you should also know that there are some persons that react that have one or two side effects when they take some kind of soft drink like Coke because of what some other thing that it contains. Yeah. So please, and also depend your age will still also be put into consideration. When you are getting older, it is better you stop taking soft drinks. Should too much of it, and focus on water. Water is better. It's natural. It's better. Even though it's better, water is better than taking soft drink. So I will advise that you reduce your intake of soft drink as as reduced as possible. Yeah, I'm not telling you to stop it, but I'm only telling you to reduce it to the barest minimum.
Okay, thank you, Dr. Israel. If you are just coming and you have not shared this live stream, why? Share the live stream, support us, invite your friends. Huh? And those on YouTube, please drop your comments. I want to take more comments from people on YouTube. Let me support you guys that are watching from YouTube. Somebody's asking us a question. Daniel says, I occasionally have leg ulcers. It occurs at least once a month. Please, what causes this? Dr. Israel.
I don't think we'll be able to tell you what causes your leg ulcer. There are so many factors that can lead to those leg ulcer. We don't even know your genotype. We don't know the kind of shoe you wear. We don't know where you walk. We don't know if you stay inside water for a long time. We don't know a lot of things. So I will advise that because you've noticed it that every month you always have leg ulcer, it will be better that you go to the hospital. You need to see a doctor, and so that they will look at the leg ulcer, they will examine it, and with that they will know what to do. And funny enough, I don't even know. I will not be able to tell you the specific doctor you should meet because there are so many things that can cause. There are different things that can cause leg ulcer. So you just go to the hospital, go to GOPD, and you see a doctor there, general outpatient department in the hospital. You see a doctor there. And when they talk with you and do a lot of examination and maybe some investigations, they will know where to really take you to, and your leg ulcer issue will be addressed.
Thank you, Dr. Israel. Mobolanle Akosile. Did I get it right? It's asking why IVF failed. Dr. Israel, want to respond again?
Even the natural part of life fails, talk less of artificial part of life. So nothing is 100% when it comes to medical field. In short, when it comes to life, nothing is actually 100%. So sometimes these things fail. It can still be due to there's so many reasons. There are few reasons. There are some reasons that can actually cause the failure of these things. One can be the technique. Two, the sperm, the egg. It can also be um, the person that is even carrying that they did it on, and that is the lady that they did the IVF on, can also lead to it. Now, the how professional is the person that also did it can also lead to the failure. But you should know that nothing in life is 100%. If what God has put in us sometimes fail, talk less of what um, God has given us the knowledge to do. What God has given us the knowledge to do, they too will sometimes fail as well. So it's not like it's what we want for it to fail, but it's nature. It just occurs. It just happens. And sometimes it fails. And also, When after IVF, some persons still continue stressing themselves, and you also likely have failure due to that as well. So it's better that where after doing it, you need to take a good rest and follow your doctor prescription. Some people don't follow their doctor prescription. They are very bad in that. Follow your doctor prescription, and luckily you'll be fine.
Yeah, and I also believe that before you started the IVF, they would have explained some stuff to you. They would have told you that sometimes this thing is not 100%. Do you understand? Now, if you are just coming again, welcome. You have not shared the live. Please share, like, invite your friends. Don't forget to send stars. If you're on YouTube, you can use the super chats, super tank, super stickers. If you're on Facebook, Dr. Fredo Star Official, buy stars and send. Thank you for encouraging us. Thank you very much. Yep. I take medications for restless leg syndrome, but it comes and goes. Oh yes. Okay. Yeah, restless leg syndrome, my dear. It can be very, very, very long lasting. It comes and goes. Maybe lucky it disappears. Somebody is asking us, what is hernia? Oh my God. So you want to respond to this?
What is hernia? Okay.
Yeah.
Let me just put it in a simple term. It's a protrusion in some part of the body where you are not supposed to have them. Another thing that they are not painful, they come out and they can also go inside when you push them inside, and sometimes they go in on their own. There are different type of hernia. Most common of all is the inguinal hernia, and the inguinal hernia, which is common in male modern, which is common in male. Now, female also have a hernia. We call femoral hernia, also can occur in female. We have the incisional hernia, a hernia that occurs along a line of surgical procedure. Eh? That's another type of hernia. But as I earlier said, the inguinal hernia is the most common. And in the inguinal hernia, we have the direct and indirect hernia. Now, what happened is that this hernia, and in I don't know. I'm trying not to use any medical term. I'm trying to make it easy. Now, when the testis comes down in terms of men, sometimes there's a hole. There's a hole that is left in that place where the testis passes through. Sometimes the intestine will come. You know, the small intestine is one of the organs that like walking, like going to everywhere in this in this abdomen. It goes to anywhere he likes. So sometimes it passes through that hole, and that will lead to hernia. And it will come out. And some persons, sometimes you see it when you cough. You see it as around your waist side, the frontal part. You see it pop out. You can actually use your hand to push it inside. Sometimes when you lie there, it goes back on its own. While in some cases, the abdominal wall muscles are weakened. And this is mainly for elderly persons. The abdominal wall muscles are weakened, and because of the weakness of these abdominal muscles that are supposed to hold all the intestine and all the internal structure together, because they are weakened, they allow these organs, these structures to pop out, and these structures to pop out. Sometimes this hernia can be strangulated. When we say strangulated, it means that the thing that the intestine or the part of the structure that comes out through the hole or through that defect, and he's trying to go back, he could not go back. It's just as a little child that took his head through a narrow place and is trying to bring it inside. The thing will refuse to come inside, then it will now be stuck there. So because it's strangulated, it can lead to a cut off of blood supply, and that can cause pain, and from pain, many other things can actually happen. So the main state of treatment is to go to the hernia, open it, and try to add strength to that muscle that is weakened, and try to return everything back to their normal anatomical position. So when they add strength to that part of the abdominal wall, and sometimes the hernia may not reoccur. However, it can reoccur. It can reoccur. Some persons can have it bilaterally, that is the two sides. Some persons can be just one side. So sometimes the kind of work you do can also lead to hernia. I'm talking about inguinal hernia mainly. When you carry a heavy load, it can actually cause hernia. So those weightlifter, you notice that when weightlifter, you see them tying a band around their waist. And that band is to help the abdominal muscle stay stiff and still remain healthy, so that even when they are raising whatever they are raising, it will not give too many stress to the abdominal muscle, thereby losing their strength in terms of doing their activities. So that's a brief talk about hernia. I may say that's a brief talk about hernia.
Dr. Israel, thank
I
you
don't
very
know if
much.
Dr. Fred want to say one or two.
Basically, you've spoken all about it. And what I want to say is just that hernia is only treated with surgery, no medication for hernia. Surgery. Tina Iswa. Tina, good afternoon. It's evening here. How are you doing, ma? Are you still on? Tina Iswa. I'm just seeing your comments. How you doing? A long time. Okay. Somebody's asking us, Doctor, how do I know if I have appendix? Dr. Israel, please respond though. Oh, yeah. Okay. How you doing now? How you did? How work? Okay. Let me respond quickly for the lady that asked about how do I know if I have appendix, madam or sir. Listen, appendix is not a sickness. Appendix is a part of your GIT. It's a part of your intestine. It is normal. The only time we have say there's a problem is when you begin to have inflammation, appendicitis, begin to have pain at that region. So everybody on the surface of the earth is born with an appendix, and you're fine. The only time there might be a problem with that region is when you start having infections. Dr. Israel, what's going on?
Yeah.
Okay. You're having infection, to give you pain, to give you sometimes fever, you might feel nauseous, you want to vomit, you understand, and the rest. But basically, everybody, we all have appendix. Appendix is not a sickness, it is appendicitis. When the appendix becomes inflamed, that is when we now say you have a problem. Is that okay, Judith? Tina, it's been a while. Oh, how you doing now? You don't tell. I think, Tina, we are supposed. I want to get in contact with an IVF specialist. I'm thinking we should invite one on the program. Maybe we invite an IVF specialist and also have someone who did IVF to share the story. What do you think, Dr. Israel? I think we should have an IVF specialist on the program. What do you think?
Yeah, that would be better. That would be better, at least, so
Tina
that
can help us.
they can,
Yeah,
audience will be able to know
yeah.
things about IVF, and they have
Tina,
first-hand information.
Mrs. Tina Iswa Alpha, you can help. You can help us with that, Abby. Let's fix a date on this. Let's talk now. We can chat online on Instagram. We'll chat. Okay. So somebody's asking us a question here. Good evening, doctor. Thank God for today's network. Please, is it good for a diabetic patient to take Gary? Okay, Israel, please respond, I beg.
Okay, and this drinking Gary, I don't think there's anything wrong with somebody having diabetic taking Gary, so far you are taking your medication. In fact, recently we don't actually put more how will I say it, more emphasis on don't eat this, don't eat this, don't eat this. What we normally say now is, whatever you eat, take it moderately and make sure you take your medication. Dr. Fred, are you with me?
Yes, I can hear you.
Okay. And make sure you take your medication. That's what we say now. So if the person that is diabetic want to take Gary. I don't think there's anything bad, but it should not be something that he will be taking every day or every second. He can take it once in a blue moon and make sure he's taking his medication, he's doing exercise, and with that, I think he's fine. I think he's fine. I know that sometimes when people ask questions, it's something that you want to do every day. No, taking Gary is not for diabetic patient. I did not say you should take it every day. That's why I said that it is once a while something. And you should know that it must be moderate. Whatever you do as a diabetic patient must be in a moderate form. Thank you.
If I may add to that, if you are diabetic, you should have a dietitian or a nutritionist that you are also working with. You understand? What we're just telling here is an advice basically, but you should speak with your dietitian, with your nutritionist, or your doctor privately. Okay, so Tina, yeah, Tina, we'll chat on Instagram. When I'm done with the live stream later, I'll chat up with you on Instagram. Let's have a discussion on IVF and also have you share um, your sure you get now. You know how it be. Yeah, I think we can make plans for this next month. Okay. Let's see. A lot of people want to know about IVF. Okay. Dr. Israel, somebody's asking us a question, says, what is it with mosquitoes and people that are O positive? I keep coming down with malaria, even when they live for the same house with other persons with other blood groups. Is it true that mosquitoes bite those that are O positive more than others?
Dr. Frey, answer that now.
Oh God. So what I don't know why you say it's O positive. Oh. There's this thing that is known that if you have about 10 people in an environment, mosquitoes can be attracted to 2 or 3 persons there. One might be what is the reason for this again? There's a reason though. I don't know if it's because of the blood group. You understand? But I know that the reason could be because I say that your body produces kind of heat or something like that that attracts mosquito to you. So what I'm going to find out more. But I know that it could be that your body is more enticing. The mosquito likes you more. I have to do that research again. This is the second time somebody's asking me this. But I don't. I'm not sure if it's because of your blood group. What we know about genotype is that if you are AA, you might get affected with malaria more than AS. Not because mosquito likes you, but because of your genotype. Your genotype gives mosquito parasites, that is the plasmodium parasite, more room, creates a conducive environment for that parasite to survive and grow and pass from one cycle to another. But those who are AS, before the parasite can multiply, the red blood cell has broken down. The red blood cell breaks, dies. So the parasite will not have room to grow. But those who are AA, the parasite can stay in their blood, can develop, grow, and cause problems. Basically, this is what we know. But for the blood group, we'll find out more about that. Okay, let's see quickly. So many questions here. I am addicted to coffee. Please don't judge me. Oh. You are addicted to coffee. Nobody's gonna judge you. It's not okay to be addicted to coffee. It has side effects, you know, right? Coffee can affect your sleep, can affect your blood pressure, and the best advice would be for you to start cutting down on coffee. People tell you that they take coffee because it keeps them alert, keeps them sharp. But over time, coffee is very addictive. That smell, I love the smell. I love it very much, but I have to run away from it. So you should do the best you can to start cutting down on this addiction. You are addicted to coffee. It's okay that you know this is what you're addicted to, but try to look for a way to call it. It's not okay. Dr. AJ, have anything to add on this?
No, not really.
Okay, let's go to the next one quickly. How to know if you have kidney problems? Dr. Israel, want to respond?
Okay. To know that you have kidney, sometimes before you start knowing that you have kidney problem, that is before you start knowing that you have kidney problem. It must have, that problem may have may have gone far a little why. However, I think going for regular checkup will actually help you to quickly know if there's any problem with your kidney. So regular checkup is better. Then two, if you start noticing that your face is swelling every morning, you wake up and notice your face is swelling, or people tell you that your face is looking like it's swelling, and as you go throughout the day, the face swelling is reduced, you may be having some issues with your kidney. Also, if you are having pain at your flank, right, close to your abdomen, your flanks, you may be having some issues with your kidney. Where you are not urinating as you used to urinate before, you may be having issue. You hear what I say? I say maybe. I did not say you are having issue. So please, you may be having issue with your kidney. But the best way to find that is to go for medical checkup. When you go for medical checkup, they do some investigations for you, run some other tests and some other examinations. And then you can actually know that yes, this person is having kidney issue. Now, what can also predispose you to having kidney issues are people that use some kind of bleaching cream. You want to fair overnight, and you want to turn white overnight. You are giving yourself up. You are exposing yourself to kidney issues. Those of us, and those people that drink alcohol a lot, you are also opening yourself to kidney to kidney issues. Okay, and some other food you take. Then if you have hypertension and you are not taking care of it, you are opening yourself to kidney issues and so on and so forth.
Thank you, Dr. Israel, for that. There are many causes of kidney problem. We have different types of kidney issues, acute and chronic. At the very acute stage, the very early stage, it might look like any problem. You might not be sure this is a kidney issue. This is why we always encourage you to go for a regular checkup. Let's select questions because we have so many comments here. Let's take this one. This one says, good evening, doctor. Please, does every convulsion in children always result from problem in the brain?
No, not all convulsion in children result from problem in the brain. Some can be from temperature. When a child's temperature is so high, it can lead to convulsion. So that's why when a child is having fever, or is having malaria, or so, is having temperature, is having increase in temperature, the first thing we tell you is to please try and tap his point. What we are telling you to do is to make sure that the temperature is reduced. To make sure that the temperature is reduced. So not all convulsion is due to issues in the brain. Yeah. So the temperature can also affect, can also cause that. However, they all relate to something to do with the brain, actually. But there are different causes that can lead to that.
Okay, he says, doctor, my ear do itch me, and I do put a drop of anointing oil and cover it with cotton wool, and now I'm feeling like there's pain. You're feeling pain in the ear. What can you do? Well, I don't know what I can tell you to do at home to help your ears. That ears needs to be examined to find out if you have caused damage to the ear or if it's something that you don't need to get worried about. So basically, my own advice would be take that ear to the hospital, let the doctor see your ear. I don't know if Dr. Israel have any contrary or something to add to that.
No, I don't have a contrary opinion from what you said. You need an ENT, a doctor that specializes in treating ear, nose, and throat to examine your ear. He's going to look into the ear and tell you whatever is wrong with the ear. They will give you whatever type of treatment it thinks will be better for that ear.
Okay. Um. Oh my God. So many comments here. Okay, let's take this one. Doctor, please, can renal failure be treated as in till the situation is reversed? Oh, renal failure. So there are different stages of renal failure. We have five. So we have acute and chronic renal failure. At the acute stage, you can manage it and you can reverse it. You can reverse the failure. When it now becomes chronic renal failure, you can't reverse it. You can only slow the progression, or maybe you halt the progression of the failure, but you can't really reverse. So if there's anything that can be done to the renal failure to reverse, it's mostly at the acute stage. But at the chronic stage, can delay the progression very well. That is if you see a nephrologist. But when it has gone past the stage 3 of chronic renal failure, most time it just keeps going like that. But you can halt it, you can stop the progression if it's at the chronic stage. At the acute stage, you can do whatever you can do to reverse it. Dr. Israel, any comments on this? Okay, let's go to the next one. I hope you heard me. Mokoto. Noble Baby says, Doc, I chatted your PA last month on WhatsApp and I wanted to chat with you one on one, but no feedback since then. Oh, I'm sorry. I don't know what happened. Try sending another message again. I don't know what happened. Maybe there were so many requests for consultation, and that was why um, you couldn't have a session. I'm sorry. But send another message. Maybe they would help you fix another one. Yeah, no vex. Yeah. Doctor, please, what really causes fallopian tube blockage and treatments? Most times it is PID infection that blocks the tube. Sometimes it can be a mass. It could be an infection, PID, poorly treated infections. Most times ladies have infections, they don't treat it properly, and then that infection can block the tube. Sometimes a woman can have issues with her tubes, maybe a mass obstructing the tube. But the most common form of of blockage of the fallopian tube is actually from infection, poorly treated infections. Good evening, doctor. Please, when is the right time for a pregnant woman to start antenatal? Dr. Israel, want to respond? Dr. Israel?
Yeah. Okay, when is the right time for a pregnant woman to start attending antenatal?
Yes.
Is that the question?
Yes, yes,
Okay.
yes.
And for me, most of the time I used to tell people this, that immediately you know that you are pregnant, you should start antenatal. But in Nigeria, I find out that it's not always like that. They want you to get to like 2 to 3 months and so on. And okay, 12 weeks. Let me use the word 12 weeks. They said because and sometimes the body can get rid of some pregnancy that are not well formed. Yeah, because of that, they want someone to. So you not just waste your time starting antenatal, and you find out that after you know what is going on, you are leaving the antenatal again. So they will advise that at least from 12 weeks, you can go and register for antenatal. But for me, I will always want to say that immediately you find that you knew that, yes, I am pregnant, you should start antenatal. Let your doctor know. The doctor may actually say, okay, don't start antenatal now, but we still give you some advice and some medications that will help your pregnancy. So immediately you find that, please see your doctor.
Yes, thank you, Dr. Israel. I think we have taken all the questions tonight. For those who are just coming, you're welcome. Sorry you came late if you're just joining us right now. This program starts 8 p.m. West African time. That is 8 p.m. Nigerian time. And we have been able to keep the time. We don't come late on this program. When it's 8 p.m. on the dot, we start 8 p.m. We don't do African time. And when it's 9 p.m. on the dot, it's either we're done with the program, or we are about rounding up with the program. It's about an hour program, and it's every Sunday When you come here on Sundays, you will always meet us. This program has been on since I think 2020 or 2021, late 2020. Yes.
I think it's 2020. I think it's 2021 or so. I
Mm.
think so.
So we've been on since for more than
No,
two
no,
years
no.
now.
2020 now.
It's late 2020.
It's
Oh,
late 2020.
yep,
Yes, it's late 2020.
yep. So guys, and we have been doing this every Sunday, answering your questions, educating you, doing the best we can. We are not saying we are the best, neither we know it all. We're just trying to play our own part and educate the public. And every time we appreciate you, we thank you for joining us. We do appeal that please help us share this live stream. Invite your friends whenever we release the flyer. Share the flyer to invite your friends. We started on Instagram. We started this program on Instagram. We didn't start on Facebook. And after a while, we decided to move this program to Facebook, and then we are now live on Facebook and YouTube simultaneously. So we want to appreciate every one of you for joining, for commenting, for liking, for sharing. Those that send stars, we say thank you. And one thing we don't do, I know I don't do it. I know Dr. Israel doesn't do that. I don't know if he has changed. Is that we don't do these private chats. People want to chat with you on social media. I don't do private chat. We don't do that. If you want to have an online consultation, it's different. But here, you ask us anything, we'll always advise you and we try to give you evidence-based medical advice. Dr. Israel, anything to say as we round up? Dr. Israel.
Okay, sorry. Your voice was cracking, so I was not hearing you clearly.
Okay, so I said that I just did a brief roundup. I don't know if you have anything else to say as we shut down the program tonight.
Okay, okay, okay. Someone Noble Baby said he like consuming tomatoes. Yeah, it's fine. You can consume tomatoes. It's not bad. But please try and wash your tomatoes very well before consuming it. Yes, it's nice. It's not actually bad. I want to say a very big thank you to everybody. Thank you for always being with us. On Sunday 8 p.m. and some other days. Sometimes Dr. Fred can just come online and want to say one or two things, and sometimes I also try to join him. But we want to say a very big thank you. You guys are the ones that's making us to be here. If not you guys, we will not be here. We will not be coming online to discuss. We will not be coming online to say anything. I also want to use this medium to say if there's any topic you guys will want us to discuss, even though we've discussed it before, maybe you did not get a firm grip of what we discussed, or maybe you were not online the day we discussed it. You can actually drop it on. You can actually drop it now. We'll take note of it and maybe plan on discussing these topics. Also, I also want to use this medium to thank our different people we normally invite, our guests that we normally invite to join us to speak to you, to speak with all of us. And they've been doing wonderfully well. They've been doing wonderfully well. We want to say thank you. Yeah, Dr. Blessing is not 100% available at the moment. He's a bit busy. That's why for some time you've not been seeing him with us. It's just me and Dr. Fred. Yes, he's a bit busy, but we believe that when his busy schedule is over, you guys will see him again. You guys will see him again. I know you guys have missed him just as the way we miss him as well. So I also want to say a very big thank you to Dr. Fred. He has been the backbone of this Ask the Doctor. Yeah, all credit to him. He has actually been the backbone. He's the one that really pushed me and made me know that okay, let's actually be doing this. Yes, let's actually be doing this. And he's doing a nice and a wonderful work. Dr. Fred, thank you for bringing us together, even though for bringing us together. Eh? let's leave the other one for backstage discussion. So
This guy
thank you,
nowhere.
everybody.
This guy nowhere.
I will end by saying that this period have been a little bit dusty. Let's try and drink a lot of water this period, and try to keep our mental health. Mental health is so important. Apart from being dusty, we also know that the country has been in a different form for some time now, and it's affecting every individual. It's affecting every individual. So it's also good for us to keep our mental health. Our mental health is so important to us. Let's always try to remember that this is just a passing time, and it will pass. And I will end by saying on Saturday is election day. Let's go out and vote. And when you are voting, please vote for the right candidate. Vote wisely so that the next 4 years can be wonderful for all of us. Remember, whatever you vote will determine how our next 4 years or 8 years will be. So please vote wisely. Thank you.
Thank you, Dr. Israel, for that wonderful summary and vote of thanks. I keep hearing this word, vote wisely, vote wisely. Please, who is wisely? I'm not here to say vote wisely. Wisely is not, I don't even trust people wisely anymore. Vote OB. You understand? I'm obedient. Vote OB. Don't leave wisely alone. Leave wisely at home. Vote OB. This one, I'm saying with my full chest. Thank you guys. Like I always say, good life. Good life, nonsense.
Nonsense.
By this time next week, Sunday, we hope to have gotten a new president to take this country to greater heights. I'll see you next week. We'll see you next week. Take care. Goodbye, and God bless you. Bye-bye.
Bye-bye.